My name is James Monica. I'm an upper extremity orthopedic surgeon for University Orthopedic Associates. Baseball season is right around the corner, so we thought we'd uh, put a talk on staying injury-free during baseball season on our website. Um, I have no disclosures. I want to first start out by talking about sports specialization. We've seen a lot of athletes start at younger and younger ages over the past few years, just select one sport and play that sport all year round. And with that, we've seen an uptick in the amount of overuse injuries in these young athletes. This is one study that looked at 1,200 youth athletes age 8 to 18. Yes, there are some 8-year-olds that are just playing one sport all year round, if you can believe that. Early specialization in the single sport is one of the strongest predictors of injury. Athletes in the study who specialized were 70 to 93% more likely to be injured compared to children who played multiple sports. So what is sports specialization? It's high volume and intensity of training involved in a single sport all year round. The duration of the training occurs typically at a young age. There's minimal rest or time off. It's very structured training with an emphasis on physical development in that single sport, and obviously no other types of sports on organized teams are played. The theory of sports specialization is based largely on an interpretation of a study by Erickson from 1993, where they showed that high volumes of deliberate practice at a young age was the strongest predictor of becoming an expert performer. Many of us have heard of the 10,000 hour rule, where if you dedicate 10,000 hours to a particular task, you can master it. This often holds true with musicians, mathematicians, chess players, but not athletes. It's too much time to spend on a single sport at a young age to not incur some type of injury. There's no specific number of hours that has been proven to master a task in athletics. So who specializes and why? Children, often who are slightly older and more physically developed, are more likely to specialize early. They realize that there's a potential for scholarships or professional contracts. In reality, only 0.2 to 0.5% of high school athletes ever make it to the professional level. Only 6% of high school athletes will play on some level in the NCAA. These kids often get positive feedback from parents and coaches. It turns out parents are the strongest influence on the initiation of sports, but coaches are the strongest influence for sports specialization. There are several disadvantages of early sports specialization. Burnout is very high in those athletes that are just playing a single sport all year round. They become socially isolated. They're always with this, with one group of kids who are also involved in playing that sport. They often can withdraw from these sports. It doesn't produce the same amount of fun as it used to at earlier ages, and then they develop a feeling of a performance pressure, especially in older athletes. And then there's an increased risk of injury. Several collegiate coaches have been interviewed on this topic in terms of who they would rather recruit. Would it be a single, sport specialized athlete, or a multi-sport athlete? And usually across the board, lacrosse, football coaches, they all prefer the multi-sport athlete. Baseball in the age of specialization is definitely an issue. These days, baseball should not be a year-round sport. Approximately 5 million children ages 6 to 17 participate in organized youth baseball leagues in the U.S. Since the 1990s, there's been an increase in independent baseball and travel teams. Typically for pitchers, talent recognition occurs in the latter years of high school, and peak performance in the mid-late 20s, and then retirement before the age of 40 in the professional pitchers. Recently, there's been an uptick in the amount of elbow injuries, the Tommy John surgery that many people have heard of, where approximately a quarter of those surgeries are performed in youth or high school pitchers. So to break down pitching, there are 6 different phases. There's two phases where often, most times, the injuries occur. Between the late cocking phase and acceleration is where maximal stress is placed on this inside portion of the elbow right here. So elbow injuries commonly occur in this late cocking phase to acceleration. Then follow through, where you have this short deceleration phase where the arm starts slowing down. That often is correlated with shoulder injuries. Proper mechanics is critical to trying to prevent injuries. Power for throwing comes from a strong core and legs, not only arm strength. Running builds leg strength and endurance and is great exercise to help prevent injuries in pitchers. A well-supervised strengthening program, which includes arm, core, and leg strengthening, is really important to work on before the season gets underway. Intervention of a preventative program can help decrease elbow injury. This has been shown in a study published last year in American Journal of Sports Medicine. They looked at 8 to 11-year-old pitchers. They were given 9 strengthening and stretching exercises that they could all do at home. And they found increased shoulder range of motion following the exercises, increased non-dominant hip range of motion, increased shoulder blade muscle strength, and this decreased the risk of elbow injury by greater than 50%. It improved physical function and prevented elbow injury were the final results of this study. Tracking pitch counts are very important. In major leagues, there's rarely 130 pitch outings in a season. Pitchers are on strict pitch counts. Despite this, 60% will end up on the DL each year. Pitch counts are more important for youth versus Major League Baseball players, as the rate of injury is probably higher. The health of the arm is more important than the game at the young level. And you have to keep in mind, no college coaches will ever ask you what your record was from Little League or your travel team, during ages 8 to 15. So really keeping the athlete healthy and pain-free while throwing at a young age is obviously much more important than the game. So some guidelines for youth pitchers. There shouldn't be any competitive baseball pitching for at least 4 months out of the year. Again, you want these athletes playing multiple sports. Pitch no more than 100 innings per year. Avoid pitching on multiple teams with overlapping seasons. A lot of time pitch counts can get lost between different teams. Do not play both pitcher and catcher. Second to the pitcher, the catcher is doing the most throwing. Back to the pitcher every time, and then occasionally to bases. Play other sports. Discontinue pitching if complaints of elbow or shoulder pain begin, and also see a doctor. Earlier intervention is better than later. So pitch counts, these are examples of recommended pitch counts, and also days of rest in between pitching based on age. Key points are to avoid pitching on consecutive days, avoid pitching multiple games in the same day. This has been associated with an 89% incidence of injury. Injury rates also have been shown to increase when pitching activity exceeds 16 hours per week. So what are some ways of tracking pitch counts? There are apps actually that are pretty easy to use. PitchX, My Pitch Count, and there's several others that you can find that make it a lot easier to keep track. Interestingly, there was a study done looking at whether the players know, some of the guidelines, or know that, that if they are at increased risk of injury with the more they throw. This study was done by U.S. Baseball in 2014. They determined, after questioning athletes at different ages, that 13 to 16-year-olds were the least knowledgeable. Interestingly, the 9 and 10-year-olds and 11 and 12-year-olds were the most knowledgeable. 85% of these athletes had never heard of the guidelines for pitch counts, and 62% of them disagreed with the statement, the more you throw, the more likely you are to get injured. 57% would not seek medical treatment for a tired or sore arm. This really emphasizes the need for education at a young level. Another question that's been looked at is, are the current guidelines adequate? So we reviewed the pitch counts, even the pitch counts or innings per year. Um, this one study looked at 10 to 13-year-old pitchers. They did MRIs of their elbows, and they did this before the season and then after the season. And then, despite 100% compliance with pitch counts, 48% of them had developed abnormal findings on the MRI, and 28% of them experienced pain. The most concerning injuries were an increase in the width of the growth plate. They also noted a decrease in internal rotation by 11 degrees. The greatest risk occurs with year-round play, and also there was lower compliance with unenforced guidelines, where year-round play and single sport specialization really increases the risk. Additional recommendations include avoiding post-game coaching and practicing. This is a time for rest. Avoid the use of radar guns. That's been associated with a lot of injuries, given that the kids are trying to throw as hard as they can and really not paying attention to proper mechanics. And then watch closely for signs of fatigue. Signs of fatigue usually begin around when the pitcher starts throwing more than 30 pitches an inning. If they start struggling to find the strike zone, and then it should be noted that there's 8 times incidence of injury from pitching while fatigued. Some injuries that we see, there's some broad names that cover a lot of different diagnoses. One is called little leaguer's shoulder. The most common cause of a little leaguer's shoulder is a more specific diagnosis called proximal humeral epiphysitis. The proximal humerus is the ball portion of the ball and socket joint that makes the shoulder. The epiphysis is the growth plate, which is right here. And if it's inflamed, we call it epiphysitis. So it could be inflamed, or even a fracture can develop here. The weak point of the shoulder joint in kids is the growth plate. It's not so much soft tissues like ligaments. It's more the weak points are the growth plates in kids around joints. This occurs most commonly between 11 and 16 years old. The most common symptom is lateral arm pain, pain on the side of the arm, and upper arm pain when throwing. Treatment involves initially immediate restriction from activities, no throwing for 6 to 8 weeks, and then a gradual return to painless throwing. During the 6 to 8 weeks, physical therapy can start. We're working on core strengthening and isometric upper extremity exercises. Another diagnosis that kind of is a general term that really doesn't describe anything specific is little league elbow. This often is caused by medial epicondyle apophysitis. What that means is there's a bone on the inside of the elbow that's very prominent. There's a growth plate from that bone that can get inflamed. And when that gets inflamed, that causes pain, and sometimes it could even fracture. This most commonly occurs in pitchers, but may also occur in other overhead or throwing sports. And it's usually due to that, as I showed that picture of the different phases of pitching, where that acceleration phase causes what we call a valgus force on the elbow, and that leads to this injury. So making the diagnosis, pain on the medial or inner part of the elbow when throwing, difficulty fully extending the elbow due to swelling, tenderness over the inside of the elbow, and then often have a normal x-ray. Treatment is, again, rest 6 to 8 weeks, ice to the area, and then find out the cause, refine the throwing technique. Were they throwing too much? Are their mechanics not sound? And then, do they have weakness somewhere? Usually it's, when they fatigue, that's when these injuries occur. So fatigue often involves placing more stress on the arm when the legs or the core should be absorbing that stress. So strengthening the arm, the back, the core muscles, and the legs are very important. So in summary, you want to be aware of pitch counts and act early if there's pain. Rest is extremely important. Proper mechanics and training are crucial for prevention. And lastly, I can't overemphasize it enough, play a different sport each season. It develops different muscle groups. The kids learn different strategies, both mentally and physically. in the different sports, and it's just much better overall for their health. Thank you very much. Good luck with this baseball season.